Hi there, it's Heidi here from the Nest Kids CPR and Allergy, and in today's video we're going to talk about skin prick testing. Now, skin prick testing is something that's really important to realise that it's just a part of the puzzle. So what you're going to learn in today's video is that you can't always take the number on the skin prick test as the exact kind of instruction of what you should do with food in regards to your child. So keep listening all the way to the end, and we've got a special series to invite you to. Okay, so we'll get going with just the basics of skin prick testing. It is done slightly differently in different places. So you might go to a hospital and they do it one way, and then you might go to like a private clinic and they do another way. But it's really just a different way of actually agitating the skin to get the allergen just under the skin. So just rest assured that it all basically has the same result. It can just be done in slightly different ways. So skin prick testing is, like I said before, just a part of the puzzle when it comes to diagnosing a child with a food allergy. What the doctor really needs is a good history, the skin test, sometimes a blood test they might take, not necessarily that often, but they might do a blood test as well. And if the child has eaten the food before, maybe if they've eaten it on a regular basis and seem okay with it, there's all these clues. Sometimes a child can show that they're sensitized to something on a skin test, so that it might be like more than 5 millimeters big or something like that. But actually that child eats that food twice a week, every week without trouble. So what that tells us is that there is a sensitivity there. So this is exactly the type of child that we don't want to stop eating that food, because a child that already has proven to have a sensitivity, if you suddenly stop a food that they're okay with, then, which some parents do because they get a bit spooked by the skin test, if you suddenly stop that skin test result could end up going way up, and the child could be very sensitive to it and create quite a nasty allergic reaction. So skin testing is a good source of, a good piece of the puzzle, but it's not everything, okay? So it can be done in a few different ways. It's always basically a drop of the allergen. We normally do it on this part of the arm. Some places can do it on the back or on the leg. It really depends. If the child has really bad eczema, it's really trying to find a part of the skin that isn't too affected. And often there'll be a way to be able to see like which food or allergen, pollen or whatever is where. Like personally, I use like a grid, and you put numbers in the boxes and then correlate that same number to the thing on the sheet that the doctor's asked for. Some places actually write like PE next to the peanut one, or PC for the pecan. Some people actually write initials on the arm, but it doesn't really matter. It's all the same. Then either it's the prick and the allergen is put on at the same time, or sometimes the allergen drop is dropped on and then the prick is done. So I've got an example here of one of the prickers, which is used at one of the private clinics that I'm associated with. And this is, I don't know if you can see this here, a single use. And what it has is, I really don't know if you'll be able to see it because it's a bit blurred. There's teeth at the end there, tiny little teeth. And what they do is that sits in a well of allergen. And when it gets taken out, those little teeth here have kept a little bit of the allergen in them. And what they do is we then do the skin test and we press down and do a little twist. And that is enough to break that top layer of skin, let that little bit of allergen in, and then we toss it away. Okay, so that's one of the ways that we do it. But as long as that piece of allergen has gone under the skin, that's what we're looking for. There's some very rough criteria, and I will throw out some numbers, but it doesn't mean that it's an absolute that this is what you feed your child if it's this number, okay? So these are just some ballpark figures that we generally say anything less than 5 millimeter by 5 millimeter is what we call negative, but again, very much depends on the child's history. Anything between 5 and 10 millimeter, there's definitely a sensitivity, but there's a possibility there maybe for food challenge. It's not really, really high. However, if this child has had anaphylaxis recently to that food, even if it was just 5x5, we wouldn't do it. There might be, so then maybe if it's like 10 or above, 10 millimeter by 10 millimeter or above, then normally we wouldn't be doing food challenges. We would be sitting and waiting with that kind of result. But there is exceptions to that sometimes some doctors will do baked challenges. Even if say the egg or the milk is a bit higher than 10, they might do baked, and that's because we know that the protein is baked out of the food, or not completely, but quite a bit of the protein is baked out of a food when it's baked in an oven at like 120 degrees for 20 minutes. And it's the protein that we react to. That's what causes the allergic reaction. So that's why sometimes we start with a baked challenge. And that's probably one of the only times we would do a food challenge with a skin test of above 10. But none of this is an invitation to feed your child a food that they're allergic to, just because maybe you've been given a number. Always listen to your specialist. Generally, we don't recommend doing a food challenge if your child hasn't had a skin test in the last 6 months. That's from my personal point of view. Some places will do up to 12 months. We'll not do a skin test if they've had one in the last 12 months. Equally, that's fine. If there's an immunologist on site and they're happy with that, that's okay. But just personally, we kind of tend to say that 6 months is a good time to redo a skin test if you're about to do a food challenge. Skin prick testing is the primary form of diagnosis in IgE-mediated allergies. So IgE-mediated means that's so the histamine response when the IgE sticks on the mast cell and then the body is exposed to that allergen, the IgE gets the mast cell to release the histamine. So what we know is that non-IgE-mediated allergies don't show up on skin tests. So IgE-mediated allergies, which are the ones that we are, familiar with the hives and the sneezing and all that kind of thing, then that is shown up with a skin test. There is a thing called FPIES, which is food protein induced enterocolitis syndrome, and that basically is it's a non-IgE mediated allergy. It's a gut reaction. The gut gets very inflamed and upset. Basically, there's profuse vomiting to the point where the child can sometimes be very pale, limp and floppy. And sometimes we'll do a skin test to prove FPIES, because if we're suspecting FPIES and then we do a skin test and it comes back as 0, but there was a very clear reaction to that food, then that's telling us, yes, that probably is FPIES because it's a non-IgE mediated allergy. All skin tests should be followed up with a proper explanation. We've recently had a poor family that we've had to undo quite a lot of damage from a specialist who did skin testing and then just said, yeah, there's a sensitivity of above 5 mil to this, and this. Don't eat any of them. And then no follow-up, no nothing. And that just leaves the family completely in limbo. With no follow-up, and what actually they didn't know was that we've been seeing that family for years over in the hospital, and some of the foods that they tested that child to, he'd actually safely been eating for quite a while, but there was a high anxiety in this family because this child had a lot of allergies and it had taken a lot of hard work to introduce those foods. That was quickly undone in a half-an-hour appointment by another specialist who actually doesn't obviously specialize in food allergy, because he didn't give any follow-up or any consistent advice of, this is your skin prick test, we'll have to recheck this in, or ask what the child is successfully already eating. So we had to undo that anxiety and make sure that those foods did stay in the diet, because they already are in the diet and the child is thriving with those foods. Otherwise the child would have been down to a very few foods that they've been able to eat. The last thing to say about skin prick testing is to make sure that your child hasn't had any antihistamine. Obviously, what we do with skin testing is we'll do two of the pricks are going to be, the first one normally is saline, and the second one is normally histamine. And what that is that's our control. So when we prick number 1, which is normally saline, you'll want to see that there is no result. And then when you prick number 2, which is histamine, you want to see a result ideally of 5 mil and above, because then that shows us that the body is acting normally to histamine so that the other results are accurate. So if a child has had antihistamine, obviously it's going to hide the results and it's not going to be like an accurate test. So I hope that was helpful for you today. Don't forget to hit subscribe and drop us a comment. Let us know what you thought of this today. Let us know your stories. Have you got any stories about skin prick testing? Have you got any questions about skin prick testing? We have a 5-day allergy mum survival series. It's kicking off on Monday and we're very, very excited about this. So make sure that you look at the link below and go, or you can go over to our website. It's at the bottom of every page on our website, and join up and join us on Monday. There's going to be a Facebook group discussions as well over those 5 days with allergy nurses inside, and also a really beautiful workbook. So take care and we'll speak to you soon. Bye bye.